Let's see how this could affect you. Right now on the phone, we have with us here Danny O'Connell, and he's a health insurance expert, and he runs the Benefit Resource Group. Danny, good morning and welcome.
Good morning. Thank you for having me.
Can you shed a little bit light on these increases in the Affordable Care Act premiums that we're seeing nationwide on average?
We're going to do our best.
Let's hear it.
So you've got a couple of factors that are going on. One, the community rating has meant one of the largest increases on individuals. Mm-hmm. And I hate to use the word discount, but you no longer get the benefit if you're healthy. You're now put in this pool with everybody, assuming that everybody has a health condition.
Well, that right there on its face is wrong, but go ahead.
Okay. So you put all these pools. Well, the problem is if you are an individual in your 20s, mid-25-year-old, you're looking at premium increases of anywhere from 50 to 100%, making prices double versus where they were years ago. So it makes it harder to get younger, healthier people into the pool.
Indeed.
So then you have a smaller population with higher premium, higher claims, which is going to mean higher premiums, and you get into this death spiral. And the problem is we're getting this death spiral with the plan faster and faster than what people expected out of Washington. It gets these increases where people just can't sustain and be on these types of plans, so they get off. So you start losing more and more healthier people in the plan, so your rates keep going up. So you've got that. The next one is for people who were eligible for subsidies. There's no saying that your subsidy is going to keep up with the increased cost of the insurance and how premiums continue to go up. For 2014, the first full year that we have data for, 50% of the people who were eligible for subsidies and received them, half of them owed some money back. So even though their premiums were lower, at the end of the year, they still wound up paying more than what they expected. And then finally, it's why I talk about the hidden increases of this plan. The fact that your networks are smaller and smaller, you have fewer providers that you can go to who will take the plans, and the fact that the plans change each year to where your out-of-pocket goes up a little bit.
We've been seeing some of these co-ops go under, about 11 of the 23, and these were designed to stimulate competition, and they've fallen flat, and they've left us on the hook for $1 billion or so too. And is that adding, of course, to the increase in the premiums that we're seeing in places?
Sure. You can't. I've gone through this bill and gone through everything with the law, and there's no one place that you can sit there and point and say, wow, that's really going to lower the cost of my health care and the cost of the services that I receive now. Mm-hmm. You take into account the premium increases, and then plus, in addition to the premiums, the 26 individual tax increases that we are now paying that accompany this that have nothing to do with your health insurance premium, whether you're getting insurance or not.
Everything from a certain value on a certain house gets factored into it. And I think medical appliances or something like that is in on this. And there are a few others as well. Like you said, 26 of them that you wouldn't think would have anything to do with it have everything to do with it.
That's correct, and they all drive cost on all of us.
Now that's insane. Danny, one thing that I've seen with so many people is that they can barely make the premiums as it is, and once they're able to make the premium payment, it puts a strain on stressors on other parts of the budget. And when it comes to visiting a healthcare professional, they'll put that off because they can't meet the deductible.
That's right. When you look at the first year, and we're talking about the entire country, these are national statistics. 8 million people enrolled in health plans. Mm-hmm. 6.5 million of those had prior coverage whose coverage was canceled or deemed it didn't meet the federal guideline. So you had 1.5 million net new. At the end of the year, only 700,000 of those are still in force because people thought that they were getting one thing, but then when they walked in and had to come up with $6,000 before anything was covered, they couldn't afford that. If they can't afford the premiums, they can't pay that.
Yeah, I mean, so it became instead of the Affordable Health Care Act, the semi-affordable health care premium Act, because you're not getting any more access to health care unless, of course, something catastrophic happens. And remember, Danny, there used to be those policies out there a few years back called catastrophic policies, and I remember younger people actually getting those. When I was in college, people were getting those, and I said, well, what's that for? Well, if I get in a car wreck or an airplane crash or something like that, I got something. But, I'm not going to be seeing a doctor. Heck, I'm 22 years old. I don't even get a cold. And that was the rationale back then.
Yeah, we had a student health plan that covered 1,100 students in Dallas. Mm-hmm. Covered maternity, had, very, very much affordable for the students in the university. And it was canceled because it did not meet the Obamacare guidelines. They could not renew the plan. So there's 1,100 students that just lost their health care coverage.
Yeah, just like that. Boy, I tell you, Danny, thanks for doing the hard work and putting the pencil to the paper and breaking down the numbers for us.
Appreciate it. Anytime.
All right, Danny O'Connell, appreciate you.